Hey guys, so I found an article called The Forgotten Radial Nerve, a conceptual framework for treatment of lateral elbow pain. So currently I'm at an outpatient orthopedic clinic in Raleigh, North Carolina, and we frequently treat patients with lateral epicondylitis. Lateral elbow pain, frequently diagnosed as lateral epicondylitis, is a prevalent musculoskeletal overuse disorder that affects 3% of the population and has serious consequences for musculoskeletal health, occupational performance, and overall healthcare burden. Most treatment options available are targeted at the local pathology of the common extensor tendon at the apparent source of pain and do not adequately address the cause, the source of overuse, or mechanism of injury. So, some patients do receive steroid injections and state that it really only provides short-term relief of pain and not so much long-term relief. The purpose of the study is to reduce symptoms of upper extremity musculoskeletal overuse in populations at risk by addressing a broader systematic approach versus a localized symptom-driven approach. The proposed treatment approach combines mobilization with movement, elastic taping, and isometric exercises, joint alignment, neural tension, and the superficial sensory nervous system. Categorizing symptoms into mild, moderate, and severe rankings based on the numerical rating scale helps customize treatment guidelines for each client's individualized presentation. So, the Think in Nerve Length and Layers conceptual model was used to identify the source of joint, muscle, nerve, and/or superficial tissue limitation. And what's interesting is this is a relatively new concept because this article was just published back in June. So they're still developing evidence with this model. The model is based on the interdependence of the following multiple factors that influence the tissue response to overuse injury. For posture and position, pain that is centralized to the lateral epicondyle or more diffuse and tender along the proximal dorsal forearm is associated with positions and occupations that involve prolonged, repeated, and/or combined movements of wrist extension, elbow flexion, forearm pronation, and grip. For muscle imbalance, you want to think of levers and pulleys. So it's important to determine if the pronators and biceps are overfunctioning and if the triceps and supinator are underfunctioning. If this is the case, it's important to address the imbalance in treatment as muscles shorten as a result of postural adaptation over time. Joint alignment or malalignment can significantly influence range of motion, strength, and pain. You should consider the possibility of a joint positional fault that may influence pain. So, joint positional glides should occur laterally, medially, or rotationally to assess pain, correct the position manually, and then reassess the position. The glides are considered successful if pain is eliminated during the activity. No pain reported indicates the corrected alignment of the joint, and then it should be set in that position with isometric exercises. For nerve length, the radial nerve has a limited amount of excursion that allows for joint motion across multiple joints during performance of occupations. Any factor that limits that excursion along the entire length of the nerve, such as the prolonged, sustained, or repetitive traction, may result in neural tension that manifests as pain. And lastly, the superficial sensory system. Scars, incisions, and tightness at the epidermal level will influence the dermis and hypodermis underneath, where the sensory and pain receptors are providing important feedback to the brain. Manipulation of the skin via manual techniques and taping can influence mobility and pain response up the chain of tissue levels to fascia, muscle, and joint. Skin and muscle do not always move in the same direction, which was a new concept to me and interesting because movement occurs between the superficial fascia and hypodermis. So it's really important to consider all layers involved and not solely the muscle or tendon. So I know that was a lot, but overall, I found this study to be a very unique approach to treatment for lateral epicondylitis and that it takes into account a variety of factors than strictly a localized intervention such as steroid injections for pain relief, like I mentioned earlier. From this approach, the study found that pain relief occurs in less therapy sessions and in the short term shows promise for long term benefit. And it'll be interesting to follow up the study to see if patients have sustained benefit over time. And that's my reference. Thanks.